the topic. You know, nowadays the people have more opportunity to access the technology like computer and a smartphone, and that's the reason why the myopia are more popular. And so that's the reason why I want to present the topic today is myopia. Myopia is about known as the short-sightedness. My presentation is included 3 parts. In part 1, I will tell you our definition and some signs of myopia. In the second part, I will tell you about some things about the reasons for myopia. And the last, I will show you some treatment of myopia. Now we will move to part 1, definition and signs of myopia. The first is my definition. Let's take a look at the picture. You know that this image of the normal eye and this picture image from the myopia eye. And so the definition of myopia is that it is a common vision condition where you have ability to see objects near to you clearly. However, you can't see the objects farther away you clearly. It is blurry, and you can see that. In particular, you can see that there are 2 pictures about the difference between normal eye and myopia eye. It is an eye disorder focusing the image in front of the retinal. Instead of on your retinal. Retinal, that means a place which the parallel light hit on the cornea. That is the cornea, and it will put them and it helps you will see the objects clearly. But you see in the myopia eye, the light don't put in the retinal. Retinal, that means, you know, retinal, that means a place is back of the eyes, and it is near the optic nerve. And you can see pupil. You know, pupil, that means a student, primary student. But in the surgery, they use pupil, that means đồng tử. And the iris, it means con người. And the cornea, that means a part of the eyes is in the outside, giác mạc. Yes, and retina, that means võng mạc. Yes, and you can see that images are formed directly on the retina. This creates good vision at a far distance, and you can see that it makes objects blurry. And you know, before move to the size of the myopia, you know that myopia isn't disease. It is just the refractive error. I mean, là một cái gọi là that's right, the khúc xạ. Yes. Refractive error is that when the parallel line hit in your eyes, it is don't put in the retina correctly, and that's the reason why you can't see objects clearly. And you know that there are so many signs of myopia, but you can see the picture of in this television. You know, the eyeballs of him are very large and big, and moreover, it is prominent. That means nhô ra, lồi ra. Yes, and moreover, you can see that the pupils are large and the cornea is more curved. Do you know curve?
Yes.
Yeah. And the anterior chamber is deep. Đây là ổ hốc mắt. Yes. And all of them makes some symptoms like you see object blurry, and moreover they have to suffer from headache and tired eyes every day, especially when you accept at the computer a short time, you still be tired. And look at the chart. You know that some countries in the East Asia have the highest percent of myopia. You can see that, yeah. And now, and in the past until now, and even in the future. And moreover, it's very easy to understand that the percent of myopia in the rural area is lower than the residents in the urban area. You know, in the city, the children as well as the adults have more opportunity to contact with the technology. So it is reason why they can cause the myopia as well as some refractive error. Yeah, and now I will show you some reasons of myopia. You know, reasons. There are so many reasons of myopia, about the bad habit, and about the scent and so on. But in the presentation today, I just can summarize in two main reasons. That is congenital myopia and general growth. Congenital myopia, it plays major role. You can see that this is the premature birth, and the rate of myopia is very high in this situation. And you can see that genetic factors. It means that because the myopia is inherited, so if their parents are short-sightedness, maybe their children have the myopia because of genetic factors. And you can see that. Yeah, and in general growth, it plays minor role. You know that nowadays the children have many bad habits related to eyes. For example, they sit in front of television at the short distance, and moreover, they study in order to do the homework wrong. Posture, yeah, and you see that, and both of them make more growth of retina. It means that the retina is trained quickly. But you know that in the during the time from 8 to 12 years old, the teenager trains their body, so the myopia becomes worse. But between the 20 years old to the 40 years old, it is stable, and at that time there is little train, and at that time we can carry out some surgery about the myopia. And now I will show you some treatment of myopia. You know that there are so many kinds of methods of myopia, but until now I will divide it into two methods is optical treatment and surgical treatment. Optical treatment just means that you can use the spectacle as well as glasses. Yes, and you can use some lens. And both of them will help your eyes look objects clearly. It will train the conical and the retinal. You can see that. That is the curve. That is the curved lens. Yes, when the light parallel lines come to here, and it will put the object image of the object is on the retinal. And so, what's about the surgical treatment? Actually, there's so many surgical treatment, but in my presentation today, I just introduce three methods. That is PRK, LASIK, and SMILE. SMILE is very surprised. Yeah, and you can see in the PRK, in this PRKs, people, the eyebrow surgeon will use the eye drops to make soft corner, and then they will use the surgical scabbard. This means a kind of surgical knife. Yes, and they will open. It means that they will remove the corner, and then they will use the laser will be beamed on the surface of the cornea. It can help cornea train the retina, and at last they reshape the cornea by some surgical instrument like that. And you know that in this process it is very dangerous because for some person who have the thin cornea, it is riskier than other people who have the thin and the thick cornea. Yes, but in the second version, they use the method LASIK. You can see that they still use surgical scalpel, but in this process they don't remove all the cornea. They just remove a part of cornea. You can see like that, and then the same step with the first version. They beam the laser onto the cornea to train size of retinal, and at last they fold this cornea in order to reset the cornea. And the new thing of this process is they create the corneal flap. The flap that means flap. It means đó là một cái đa số đọc vào. Không phải. And the last, you can see this the last method is SMILE. This is the most advanced treatment of laser surgery until now, and so many people choose this, although it's very expensive, but it is safer and have the lower risk for the patient. And after that, after carrying out this method, the patient will have a little comfortable feeling, and they will have the short time recovery. And you know that in each step they will carry out differently from two treatment. You can see that it is the first step. They don't use the surgical scourge as well as the knife. They just use the surgery instrument in order to make a whole thin hole lenticule and small access point. It is about less than 2 millimeters in the intake cornea. It is created, and then they will create 2 layers on the cortical, and after that, in step 2, they will put the second layer outside, and at that time you can see that the removal of the small layer is change shape of the cornea, and after this step 3, the eyes of the patient isn't hurted, and moreover they can be finished a short time. And now I will show you the difference between 3 treatments. You know that it is the first method. It make change on the cornea, and in the LASIK they use it is effect from this point to the other point, and at last in the smile process it can be create a small hole about 2 millimeters. Yes, you can see that, a thin layer, and that is, you can imagine that 20 millimeters, and it's 2 meters. So it means that the patient have a long time to recover, and you can see the PRK. It is the first generation. So the long visual recovery accompanied by some discomfort. And the second, you can see that after using this method, the patient can be feel dry eye for a long time, maybe for 1 year or 2 years, and they have to limit some heavy spots like baseball, no, like some heavy spots. And you know, in the last, it is the least. It is the least disadvantages. You know that because it creates the small hole on the eyes. And now I will show you something about. Now I will show you something about the 3 methods
we have available to correct your vision, to reduce your dependence on glasses and contact lenses. It's basically alphabet soup. You've probably seen these terms before. PRK is photorefractive keratectomy. LASIK is laser in situ keratomileusis, and the new one is called SMILE, small incision lenticule extraction. We're going to kind of go through each one of these in detail. The PRK procedure involves removing the surface layer of cells, which are like skin cells, from the cornea. That's followed by the laser to do the reshaping, which is customized to your correction. And then the contact lens is placed on the eye. The total procedure takes about 15 minutes to do both eyes. The contact lens will stay on for 4 days. That's how long it takes the surface cells to heal. During that time, it's intermittently light-sensitive tearing, standing greedy feeling in the eye, the vision is going to fluctuate. The vision improves fairly rapidly once we take the contact lens out. The contact lens will be taken out on the 4th day after surgery, but it's about a week before patients feel comfortable driving in general. The light sensitivity, the scratchiness lasts while the contact lens is in. Usually the second post-operative day is the most uncomfortable the vision can actually take a drop on that second postoperative day. PRK in general does have some risk of dry eye that most patients will experience for 3 to 6 months, and unusual situations it can last up to 1 year. PRK has been around for more than 25 years. PRK is typically used in patients who have corneas that are on the thinner side, which does not allow us to perform LASIK because we don't have enough tissue to work with to perform the flap and the correction for the vision. It's appropriate for patients with nearsightedness and astigmatism and farsightedness and astigmatism. LASIK was created to shorten the recovery time that was experienced from PRK. LASIK involves using a laser to create a flap. The flap is reflected back, and the other laser is then used to do the reshaping the same way it's used in PRK. But now when we reposition the flap, the surface is essentially intact, and so it's a very fast recovery time. The eye is light sensitive for about 4 or 5 hours while the edge of that flap heals. Typically suggest patients go home and sleep through that time. Vision is excellent on postoperative day 1, and patients can drive themselves in for the postoperative appointment. The vision stabilizes very quickly. Within several days, the vision is really at the point it will end up as the final vision. The light sensitivity, as I mentioned, lasts for a very brief period of time. This is why LASIK has become so popular over the PRK procedure. It does have associated with it the same dry eye risks that PRK has, and on average, patients have dryness for 3 to 6 months following the LASIK procedure. PRK and LASIK are both appropriate for patients that are nearsighted and with astigmatism, which is a football shape in the front of the eye. LASIK is the most commonly used procedure for nearsightedness and astigmatism and farsightedness and astigmatism. We are limited to some level with higher corrections with LASIK because we need room for the flap. We have to have enough corneal tissue to create the flap and perform the laser correction for the vision. The newer procedure is called SMILE. It involves using a single laser to create a contact lens shaped piece of material within the cornea. A small tunnel incision is also created with the laser, and then that contact lens shaped piece of material is removed through that small tunnel incision. The procedure is quite rapid, lasting about 10 minutes. The discomfort, the scratchiness of the eye lasts for only a few hours. The eye can be light sensitive for a few days. The vision is excellent on postoperative day 1, usually about 90% of the full correction. The remaining 10% can take several days to settle in. The great thing about SMILE is it is minimally invasive, allows us to treat higher corrections of nearsightedness, and typically results in a shorter duration of dry eye than we would see with a LASIK or PRK procedure. So SMILE is very nice for patients that have pre-existing dry eye. The most important point here is that we have all of these procedures available, and we look forward to seeing you at the UCLA Laser Refractive Center to undergo a comprehensive examination and determine which of these amazing procedures is the most appropriate for your individual situation.